You're listening to the Limitless Broadcasting Network.
Your whole life can change in an instant. About 50 million adults in the United States have chronic pain, and because of a car accident, Robby is one of them. In their marriage vows, Robby and Sammi promise to stand by one another and provide strength when needed. And lately, they've been facing some of their biggest challenges. Join them as they share the ups and downs of living with chronic pain.
Hello, everybody. This is The Painful Truth of Living with Chronic Pain. We're your hosts, Robby
And Sammi.
and we have a special guest for you on this episode. We're very excited. Who do we have with us?
We have Dr. James Barrow, who does your acupuncture.
Yeah. Introduce yourself.
Sure. My name is Jim Barrow. I'm a doctor of Oriental medicine. I've been doing this for over 20 years. I absolutely love doing it because the people that I see are people who've seen most everybody else. We're kind of like the last stop. And it's really neat when you can help somebody that's already been through the gambit of things and we're still able to give them satisfactory results. So I love doing it. Yeah.
Mm-hmm. Okay, so kind of start in the beginning. How did you get into this field?
Sure. I really, 30 years ago, I would not have expected that I would be an acupuncturist today. But when I was in the Navy, I was stationed in Jacksonville. It was my first duty station. And I had been looking a long time for a Chinese martial arts master. One of the shows in the 1970s that I was really inspired by was a show called Kung Fu with David Carradine. And, I was just like every other kid out there. I was wondering, man, I wonder if that stuff was real. And so I read a lot about Chinese martial arts specifically, but I never found a true master of what we call internal energy cultivation until when I was stationed in Jacksonville. I met a fellow who's actually a Shaolin master, a true Shaolin master. And long story short, in the training with Sifu John Palillo, it was amazing. We'd be standing in a meditative posture, embracing the middle dantian, and you got to hold still for 45 minutes. And after a while, you just want to stop, and just every muscle in your body was on fire. And this guy would come behind you. He would just put his hands across your back. He wouldn't touch you, but he'd just move his hands across your back, and instantly all the pain went away. Felt like you were filled with helium, like you weren't even using your muscles anymore. And I'm like, man, I got to learn more about this stuff. And so that was Chinese martial arts. And I'd ask him a lot of questions. And usually his answer was, go stand in the corner and meditate. And after doing that for 4 years, it'll come to you. And, that wasn't an answer to my question. I wanted to know how this stuff actually worked. And so as I read more, the more that I read, it was pointing me toward Oriental medicine. And so in Oriental medicine, it explains about, how it is that these little guys can do these amazing feats of strength and these other seemingly supernatural things. And that's what inspired me into Oriental medicine. And so as I began to read a lot about Oriental medicine, I was like, hey, man, I think I want to do that. I think I want to try acupuncture. I tried it as a patient. I went to go see an acupuncturist in Jacksonville. I didn't have anything wrong with me, but I was just fascinated with what I was reading about. And so I had a little bit of knee pain he was treating me for. I had like 3 or 4 sessions, and it gave me an introduction into it. And then, I'd made up my mind. I said, man, I want to do this for the rest of my life. And so I went to school for Oriental medicine here in Orlando. And I've been doing it for over 20 years.
Very cool.
How long's the schooling?
Well, it's a 4-year curriculum.
Okay.
And the school awards both a bachelor's and a master's degree, at least in the state of Florida. That's what the standard curriculum is. And what that does, after you have a master's of Oriental medicine, then you're allowed to take the licensure board. In the state of Florida, like every other licensure, you have nurses, medical doctors, chiropractors, all have a licensure, and we have our licensure as well. And in fact, in the state of Florida, we're considered to be primary healthcare physicians.
Okay.
So, yeah.
I did not know that.
Hmm.
Yep.
Yeah, me
Yeah,
neither.
we can't do surgeries or prescribe medicines like a medical doctor can. But if a patient decides to come to us as their primary healthcare physician, we can order labs. I usually like to get their primary medical doctor or osteopathic doctor involved because when you start to get into Western medicine, you want their expertise on
Mhm.
what's going on. But sometimes we need to order labs.
Okay.
Mhm.
Okay.
That's cool. That's
Hmm.
very cool.
Yeah, I had no
Yeah,
idea.
and that's one of the great things about working with Dr. Thomas. You know, I'm new to this office. I've only been here a month,
Okay.
but I've known Dr. Thomas for at least 18 years,
Okay.
and it's a really it's a great thing to be able to work in the same office with somebody who has the other side of that discipline, and
Hmm.
we're able to talk to each other about
I bet it
issues.
makes it easier if you need something, you can just go across the hall and say, "Hey,
Oh
this is
yeah,
what I need.
Right.
Can you
Yeah.
help me out?"
oh yeah, it's awesome.
So, how did you get to know Dr. Thomas? I mean, you've known each other for 18 years, but how did that kind of happen?
Yeah, our paths just crossed a couple of times, a couple, three times over the last, probably starting about 18 years ago. I can't remember when the first time it was. We might have been at some convention or something like that, but we talked to each other a little bit and just get to know each other. And we knew each other by reputation, but not much socially other than that. And then what happened recently, not to get into a digression of where my office has been for the last year, but I was in a temporary office for the last year. Dr. Thomas and we share a lot of patients. We treat the same patient, and one of my patients overheard him saying that he was moving to this new facility, and they said, "Well, Dr. Barrow's looking for a place to practice," and so we started talking a few months ago, and made a decision, and so I came here about a month ago.
I know he was talking to me before you guys actually did the
Hmm.
switch, and he was very excited to have you in the practice in the office.
Mm-hmm.
So
Oh
I
yeah.
knew
Yeah.
that was going to happen.
Yep. Yeah, we've been talking about it for months. I haven't been publicly putting it out there with my patients until the very last minute because I had so many opportunities that just kind of fell through over the last year, and I just didn't want to get everybody's hopes up until I knew where I was. So,
Hmm.
So,
Makes
but
sense.
I'm glad to be here now.
so what is acupuncture? Like, what can you break that down for us? Like, can you explain it to us
Hmm.
in layman
Sure.
terms?
Yeah, it's a very mysterious concept to us Westerners, but basically what we're doing is we're stimulating a system of electromagnetic currents. We have 12 electromagnetic currents in the body, and this is a system that's completely separate from the nervous system. We affect the nervous system with these channels of electromagnetic current, but this is a completely different system. And the reason why Western medical science didn't recognize it until 1985 is because when you open the body, you don't see anything. There's no tissue like a nerve, there's no blood vessel. These are simply electromagnetic currents. But in 1985, there was a scientist named Pierre de Varnagel, and what he did was took a radioactive isotope called technetium 99. He injected it into the site where the acupuncture showed them, and with a gamma camera, they were able to watch that isotope flow exactly in the manner that the Chinese been mapping for thousands of years. In 90 minutes, it came right back to the same spot where the acupuncture had put it originally. And they took samples of what was in the channel versus outside the channel, and they found that the concentration of hormones and nutritive fluids were 90% higher in these channels. So these are like rivers of hormones that flow throughout our body. They just don't have a vessel like a blood vessel to contain them. And so what we do with acupuncture is we are stimulating that electromagnetic current, and that's going to bring in the healing liquids into the areas that we're directing. Like, if you've got inflammation in the neck, you got herniated discs or things that are pressing on those nerves, then we can reduce the inflammation that is in that area. In some cases, we're actually able to help a disc come back into place, depending on each circumstance. But I've actually seen before and after MRIs of that actually happening with patients.
That would be
Wow.
nice.
Yeah. So that's that's a way of acupuncture working for pain relief is we're sending those healing hormones into an area to reduce inflammation. But each of these channels also connects to a different organ system. And so anything that has to do with the internal organs, we can also affect everything from kidney stones to acid reflux to um, hormonal issues for women. Uh, Oriental medicine, acupuncture is a complete system of medicine that's been around for thousands of years. There's actually architectural artifacts that are thousands of years old that are tools for acupuncture. So what happens when you put an acupuncture needle in an acupuncture point? That's, the real question we're asking.
Yeah.
But you know how it is that a compass needle points toward magnetic north, right?
Mm-hmm.
That's a demonstration of how steel and an electromagnetic field influence each other. One will always move the other. If you have a piece of steel that is stationary, it is influencing the electromagnetic field in its immediate area. And so as we put these little pieces of steel in these areas of high electromagnetic influence on the body, it is moving the electromagnetic current simply by the principle of the steel and the electromagnetic current. So don't ask me how the Chinese figured this out thousands of years ago, but here we are today still doing it.
I'll tell you, when you have the needle in you, you don't feel it. You don't feel that going on. You just
Right.
feel it like you have a pin in your arm.
Yeah. Yeah. Now, some people, and depends on each circumstance and different people, some people will report that they have little sensations going on.
Okay.
And that sometimes is the current flowing. Sometimes, in 10% of the cases, especially after first treatment, a patient may experience a little increase in pain after treatment. It's because we're trying to move energy flow through an area that doesn't want to flow.
Yes.
So as we're moving energy through there, if it does not break that dam down right away, then that energy will build up and the sensation of pain may increase, but
Right.
later on it'll release. And that's, people ask me, are there any side effects of acupuncture? Well, that's a common side effect. Like I said, about 10% of the time, especially a new patient may have that experience. We don't want you to have more pain. We want you to have less pain, but the first one or two treatments that could possibly happen.
Well, your body has to kind of get used to it.
Exactly.
And that's what I was telling Sammi. Like, I'm going through all these treatments, but my body's not used to it yet. So we're just going to see what happens.
Yeah.
But I knew that you and Dr. Thomas wouldn't put me through something that wasn't beneficial for me.
Exactly.
So that's why I was like, okay, when you joined the practice, I was excited to meet you and be your patient.
Oh, thank you. Thank you.
So what are the potential benefits of acupuncture?
Like I said earlier, it's a complete scope of, or a complete system of medicine. In Oriental medicine, in China, there is a remedy for everything from cancer to cold and flu. Now, given that, there are things that I feel more comfortable in treating and things I don't feel comfortable with treating. Cancer is one of them that you do need special attention to the patient, their history. You need to have close interaction with their
Ecologists.
Exactly.
Yeah.
And so that type of attention would skew my practice. And so I would say, if someone's going to get treatment for cancer specifically with Oriental medicine, they should seek somebody out that specializes in that.
Okay.
I treat almost everything else. Pregnancy is another one. We help women to become pregnant with fertility, both men and women. However, once a woman is pregnant, that goes into a realm of you've got to be specializing in that if you're going to treat a pregnant woman with acupuncture.
And do you do that?
I do not.
Okay.
Again, it's like being an obstetrician, you're specializing in that.
Right.
And I would recommend that somebody would go into if they're looking for care while they're pregnant, to seek somebody else that specializes in that.
So,
but I treat just about everything else. So.
Okay, so what can you be more specific? Like, what would somebody come to you? Like, I come to you because I need you to help me with pain.
Yeah. So we see a lot of neck and back pain. That's the most common thing that I see. Everything from car crashes to I don't know what happened. All of a sudden, my back hurts. You wake up one morning. That happens a lot. The other thing that we see very commonly are women who are going through menopause, or women who are having problems with other female hormonal disorders. Acupuncture and Oriental medicine is very effective. The fertility, is something, when people are trying to get pregnant, it's incredible how effective Oriental medicine is. Everything from helping women with fibroids and cysts and things like that, to helping men as they get older. I'm seeing a lot of younger men even that are having problems with erectile dysfunction. That's a very big thing. Stress is a very, very big thing. It affects both men and women in profound ways.
So let me ask you, so how does a typical session go? Like, I walk into your office, how does it usually go? Like, what do you do?
Sure. Well, we have a little bit of paperwork that helps me understand what's going on as far as your medical history is concerned. And then after you fill that out, we take you back and we talk a little bit about specifically what you're here for, what your goals are, and what I think I can do to help you out. Typical patient will come in, they've got low back pain, they've had it for 3 years, they had a car wreck, and the care that they've had has been exhausted through whatever means that they were attempting to do before, and they still have pain. So they come to us, and my goal with a chronic condition like that is for someone to be either greatly relieved or out of pain after 10 to 15 treatments, which is about 2.5, 3 months.
Okay.
My hope is that after, and that's a typical thing in most chronic conditions. There are certain people that are they're gonna need more treatment than that. They're gonna be a longer period. Some people with a chronic condition, they get really quick results in the beginning, but most people after each treatment, I'm hoping that you're going to get some pain relief, anywhere from a few hours to a few days that'll last. That's why in the beginning we want to see a patient 2 times a week for 2 weeks, and then 1 time a week thereafter for about 10 to 15 treatments. You can come more often if you like, but at least once a week is what we need in order to make progress in most chronic conditions. And there are different treatment strategies for different things as well. But most chronic conditions, that's what it looks like.
So when I go into your office, you sit me down and
I was just going to ask about some of the stuff he does. One of the things I want to ask you if you could talk about was like the tongue thing.
Oh yeah,
that you
absolutely.
do. Yeah, I was wondering if you could talk about that because you always do that when you check out him.
So whenever I go into your office, you always tell me to stick out my tongue.
Yeah.
So start from there.
Sure. So tongue diagnosis and pulse diagnosis. I'm also feeling your pulse, but
Right.
excuse me, it's not just the rate. There's actually 24 different characteristics that we palpate in Oriental medicine. Things that we call weak or soggy or thready or wiry. These are all characteristics that help us understand what's going on with the different organ systems. Those are two of the most important parts of our intake, actually. And so that's why every time that I see you, I'm going to feel your pulse and look at your tongue because it's telling me what's going on right now, but also what's happened in the past. Excuse me. The tongue is like a mirror for the organ systems. And so, I'm trying to use my hand here. And so if the tip of the tongue is, if this is the tip of the tongue, then that's the heart, and then the lungs, and then the spleen and the stomach, and the kidneys and the bladder, liver and the gallbladder are represented on the side. So different organ systems manifest different things on the tongue. The fur of the tongue, the coat of the tongue, the color of the tongue. There's so much that is information that helps us understand what's going on from a Chinese medicine's perspective. So it's not just I have pain here and then we stick a bunch of needles in that area.
Yeah. So when I get on, I usually am in shorts. I take off my shirts, and then you feel on my back, and then you stick a pin. How do you know where to stick the pin at?
So
the needle, I should say.
Yeah. Sure. Couple answers to that question. First of all, these are a system of 12 channels of electromagnetic energy, and they all connect to each other. I don't know how they've discovered these channels over the thousands of years that they've been mapping them, but I do know an answer to that is that the sensitivity of the ancient masters was such that they could feel the flow of this energy with great accuracy. Excuse me. I know that because I can feel the flow of this energy to a great extent, but not to the extent that they've mapped. So I believe that their level of sensitivity is just a higher level, and so they're able to do that. And there's a lot of speculation with regard to how all that was mapped out. Okay, so I won't go down all those different roads.
Right.
We have a map, and it's generally agreed upon that this is the map of these channels, and they have many little tributaries that branch off of them. But there's 12 main channels. Now, with that, there's also corresponding points along those channels. It's like the channel that I'm pointing to right now. This is the first point on the large intestine channel. And it comes through here, and about here, you've got point number 4 along the large intestine channel. This is point number 5. There are Chinese names for these, but I'm just going to go by a numbered system because there's a couple of different systems. So anyway, so this is the flow of this channel along the large intestine channel. So certain points along this channel will have a different effect. Boy, there's just so much to go into this, but one of the systems of Oriental medicine that was put together by Dr. Richard Tan. He's regarded in Oriental medicine as a wonderful teacher. He came up with a phrase called the balance method. It's kind of the way I got the name of my business was Balancing Point, because with regard to Oriental medicine, you can balance energy out by stimulating in another point along the body. This particular method, called a mirroring image or a balance method, is taking for granted that there's a template that is represented in the arm that represents the human body. Let me explain this. So the arm, this portion could be the neck, this could be the head, this could be the thoracic area here, this could be the waist, and this could be the legs. You understand what I'm saying? This could be a model for the entire body, okay?
Right.
You got head, you got neck, thoracic, belly button area, and legs. You can flip that, and this could be the head, and this could be the foot. Okay? It kind of looks like a foot. And so you can use any point on the hand to treat the foot, okay? So this is a method called balance method that if I wanted to treat my neck and I couldn't put, on myself, I couldn't do the points exactly where they need to go, I can treat my neck by doing these points here on my arm, and it's going to work that way.
Wow.
So, yeah. So what we're, how does it work, and what's going on there is we're stimulating electromagnetic currents, these channels that have a very high concentration of hormones and nutrient fluids. And the way that we do that has many different profound answers. There's over thousands of years, there have been many styles that have been developed. And the one that I just showed you was coined a balance method by Dr. Richard Tan. And within balance method, there's actually 5 distinct methods that are completely different from each other.
Wow. So that was going to lead in my next question. There are different types of acupuncture out there.
Yeah, absolutely. Okay. There's more than I can name right now.
Okay.
But I know probably about 8 different types.
Wow.
The most common one that you will find is called traditional Chinese medicine, and that's the name of traditional Chinese medicine encompasses a certain scope that is standardized within the United States. We have a standardization governing body, NCCAOM, and they're the ones that maintain the boards, the guidelines for the states to create their own board. And so if it says traditional Chinese medicine, that's a particular methodology that actually has several methodologies within it.
Do you go to a lot of conferences?
I have.
Do you have to? Like Dr. Thomas is always going to like continuing education. Do you have to do the same thing?
Absolutely. Yeah.
Okay.
Makes sense.
Yeah. But there's it's just such a wonderful body of knowledge, because you can take it in a particular area and just continue to study that for years and years and be fascinated by it.
Mm-hmm.
So you say you don't know how to do 8 different types of acupuncture types. Are you a master in all 8 of those?
No, I mean, the word mastery I mean, it has different.
It's so many different levels.
I'm very proficient in each one of those.
Okay.
But to use the word mastery,
we're going back to the whole kung fu thing.
Yeah, exactly.
You're a master in it.
Yeah. But it's good to have several tools, within your toolbox. But I have my own comfort zone and
Okay.
things that I like to do.
So acupuncture is good for everybody.
Yeah. Now that being said, if I see somebody that's going to be served better by a different type of practice, like in the medical practice, like Dr. Thomas, I could simply refer him right across the way. There are times that when I'm questioning what's going on, that I believe it would be better served, by going to get further examination, imaging, and
right.
I've had some people I sent to the emergency room, and they ended up being there for a few days because of a heart issue. So, yeah. We don't like to, nobody likes to go to the emergency room, but the alternative is usually not a.
Well, our first appointment, you said I had some kidney issues, and I was like, I don't want to have any kidney stones. So I was like,
now that's
the first thing that popped in my mind was like, oh my goodness, I'm gonna have bad kidney stones. Those hurt.
Yeah, well, that's a very good point though, because and I don't realize it as much as, and I don't, I'm not aware of it as much as I should be when I'm talking about things like that, about, your kidneys are weak, or your spleen energy is weak. When we talk about those things in Chinese medicine's terms, it's not like you're going to get kidney stones, and it's not like you're going to have a splenectomy or anything like that.
I'm in enough pain as it is.
Yeah, exactly. Oh my God, no, my kidneys are gone.
Yeah.
So what we're talking about as far as deficiency or excess, it's the energy level, and it is manifesting on a physical biochemical level. But usually by the time that we're looking at it, symptoms have not manifested. In other words, when I see somebody that's got what we would call kidney and spleen qi deficiency, they're not having they're nowhere close to manifesting as kidney stones or something like that. We're usually seeing something like their back, they have some dull, achy pain in the back. They have frequent urination. They have to get up to go to the bathroom in the middle of the night. These are all what we call kidney qi deficiency signs.
Okay.
And also, 90% of the people that I see have some level of kidney qi deficiency. It's just part of life.
Right.
The kidneys are the most important organ system in the body from a Chinese medicine perspective. The kidneys are the battery of the body. They generate all this electromagnetic current. And so if the kidneys are weak, the whole system of electromagnetic current will become weak and have issues. Everything from high blood pressure to anxiety to insomnia, low back pain, knee pain, all of these things are have what we call kidney qi deficiency on some level. But none of those conditions may manifest as what we would normally think of as a scary thing, like, oh, I've got kidney cancer, or
I got kidney. Is that a kidney cancer?
Oh my goodness.
Yeah. So and so as I'm explaining things, I need to keep that in mind because
it's okay. Let me ask you this question. I'm sure most people are going to wonder this question. Does insurance pay for acupuncture?
Yes. Many insurance policies do have acupuncture as something that they will pay for. What I recommend is that people call the number on the back of their insurance card and say, hey, do I have acupuncture benefits? And they'll tell you everything that you have. Excuse me. I personally don't take insurance. I actually, the amount of money that we charge is about the same as an insurance copay.
Right.
We charge only $30 for acupuncture.
That was going to be my next question.
Yeah, the initial consult is also $30, so your first visit is $60, but it's only $30 for acupuncture thereafter. And
okay,
right.
So if somebody wants to book a consultation with you, how can people get a hold of you?
So two different ways. Balancingpointwellness.com. That's balancingpointwellness.com is the easiest way. You go to that website and there's a big red button on there. It says book now. You click on that and it's a very easy thing to step through. or you can call me. The phone number is at the very top of the page when you go to balancingpointwellness.com. It's 407 243. No, excuse me, that's the old one. 407 450 9170. 407 450 9170.
And you're getting busy nowadays. Like
yeah, I was out. This is where I was practicing for almost 20 years in the Conway area. And it's a long story, but I couldn't practice in this area anymore. And I went down south near the Florida Mall, and most of my patients just said, call me when you get back. So, because it's a heck of a drive if you live in Lake Mary, and I have patients from Lake Mary or Sanford. And so, you throw more time on that. That's tough. Yeah. But yeah, it's been very nice to be back in the area. Yeah.
Briefly explain the story how you came up with your name, because that kind of intrigued me. Balancing Point.
Yeah, Balancing Point. So myself and 3 other acupuncturists and a massage therapist all started Balancing Point Wellness 22 years ago, I guess it was. And so one of the fellows was, he had been to multiple Richard Ton's classes, the doctor I was telling you about that coined the phrase Balancing Point. And he convinced me to go to one of these seminars as well. And I did. And I was like, man, this is so great, because it explains, what we had been nailing our heads through in books and textbooks. It explains it in a very understandable way. That's the best thing I can do without trying to give you a background in Oriental medicine, but it just makes everything make sense. Going to this guy, and it's profound, the wisdom that is all around us, and just different things in different cultures. And without going too far into that, that's what I'll go. But anyway, it was so simple to help people using acupuncture when you understand them in the concepts that this guy was putting them in. And you get to see just how easy it is, theoretically, to balance the energy out. And if that balances out right, everything else works fine. And so that's kind of the concept behind Balancing Point, is that when we're balancing things out, energetically speaking, all the biochemistry should follow in. Now, that's an easier thing said than done, but that's our goal. That's our methodology, is we're trying to examine what the imbalances are, what the stagnations are in a specific case, move that energy properly, tonify it if we need to strengthen it. There's a lot of dynamics, but we're trying to basically come to a harmonization in the body's energy.
Okay, makes sense. Yeah.
Is there anything else you want to add in this interview?
Oh, you know what? I do want to point to this book right here, because I know people will be having questions.
You gotta lift it up.
In this book by
Lift
Dr.
it up higher.
Oh, yeah. Okay.
There we go.
There we go.
Yeah, this is a book by Dr. Yang Dwing Ming. I taught out of this book when I was teaching at the Florida College of Oriental Medicine's college there for Qigong. It's called The Root of Chinese Qigong, and it explains the dynamics of what this energy does. It gives a history of the Chinese background of Qigong. Dr. Yang he's a physicist by nature. He explains everything in a very objective way. And so I really like him. So if you have other questions, you can go to my website, balancingpointwellness.com, or you can go check this book out too.
Okay.
Very cool.
All right. Well, one last question.
Yeah.
Bruce Lee or Jet Li?
Oh my gosh. No, Bruce Lee definitely would. You talking about who would win the fight?
No, I'm just saying, who do you got? Who's your money on?
Well, if it was a real fight, I'd say Bruce Lee.
So you must have been a fan of Kung Fu: The Legend Continues. David
No,
Carradine came back.
I didn't ever see that one.
You should. It's a follow up to the original, but
really?
He has the son in the temple, but something happens to them in the temple, and then the son disappears and they disappear and they find each other years later, and the son is a cop for the LAPD, and then his dad finds him, and it's David Carradine, and he's the Kung Fu. So you should. It's Kung Fu. The legend continues.
Yeah, I've heard of that. I'll check it out.
But
I got another one for you. This question comes up every once in a while. What is the name of the movie that Jet Li was in that he used acupuncture to disable his?
I think it was oh my goodness, Lethal Weapon.
No, it wasn't Lethal Weapon. I can't remember the name of it. We'll save it for next time.
Okay.
I can't remember the name of it. But anyway, what happens is he takes a needle. He is disabling his, the thief or whatever that's trying to get away. He disables them with an acupuncture needle. But at the end, the villain, who deserves to die in a most horrible way, Jet Li takes an acupuncture needle and places it in the back of this guy's neck, in the spine. And people ask me all the time, can that really happen?
Now I'm curious, can it?
Well, theoretically, I mean, I've never asked anybody, in my colleagues or anything like that of mine, but in my mind, theoretically, it could happen because that point is a convergence point of all the yang channels. There are yin channels and yang channels. Yang channels govern the actual electromotive force, and so they're more powerful, they're more protective, there's more energy that runs through there. That is a convergence point of all of the yang channels. And so if you have that, you have an effect of a strong energy flow. In Chinese medicine, blood will follow the flow of the energy. And so if you're moving an immense amount of energy up into an area and not allowing it to circulate, but only come to that area, then theoretically, you could cause blood to come up to the head and not escape. And so it was escaping out of his eyes and stuff like that. So
I think Sammy looked it up.
Is it Kiss of the Dragon?
Yes, I think that's it.
Okay.
Yeah, I
just Googled Bruce Lee and acupuncture needle. So
it was
Jet Li.
It's Jet Li. Oh, I'm sorry.
Yeah,
well, either way, it figured it out. Google smarter than me. So
yeah.
All right. Well, is this your one last question? Is this your first radio interview?
I've done interviews before. I had one on television a long time ago. But radio, this is my first podcast.
Okay.
Cool.
Well, I definitely recommend you to our audience. Definitely look him up. I go see him every week almost now. I believe do I have an appointment with you tomorrow?
I don't have my calendar in front of me, but
let me know.
Yeah.
And thank you for joining us.
Yeah, this is super interesting.
Absolutely.
Yes, we could go on and on and on, but
I
really appreciate this.
Mm-hmm. Absolutely.
And if you guys have any more questions for him, let me know and I will get them answered.
Mm-hmm. Yeah.
Excellent. Thank you.
Thank you.
All right. Until next time.
Bye.
Thanks for listening to The Painful Truth of Living with Chronic Pain with Robby and Sammi. Make sure you like, follow, and subscribe to the Limitless Podcast Network's own channel, Instagram, and all things social media. And we'll see you all real soon.